Hello everyone. I think it's a historic moment for a company. Today launching our product, which has been kind of my baby. I'm by training biologist and I joined Contura about 20 years ago and started develop this product for different indications. So Contura is a medical device company. It's headquartered in UK and manufacturing facility and development happens in Denmark. We manufacture, develop and commercialize hydrogels for various purposes, injecting into soft tissues for augmentation of for wrinkles or when reconstructive purposes, also for incontinence treatment and for osteoarthritis. The company is established in 2000, so it has more than 20 years history of knowledgeable and manufacturing the gel and also understanding the biology of the gel. Contura's development manufacturing facility is purpose-built and situated nearby Copenhagen. So our products, we're talking today about Arthrosamid, which is a long-lasting intra-articular injection for symptomatic treatment of osteoarthritis, has been just approved this year for marketing in Europe and the United Kingdom. There's Bulkamid, which is injectable for urinary incontinence treatment. It's been PMA approved, and recently we sold that business part to Axonics Modulation Technologies, American company. As I mentioned, there is Aquamid, which is a product for soft tissue augmentation for reconstructive purposes of the face, for instance, the nose bridge augmentations and so on. And Arthrosamid Vet, a long-lasting intractable injection for animals and specifically equine and canine species, which have been in use in these animals since 2009, so more than 10 years already. And more than 10,000 horses have been treated with excellent results. So looking at the history of development of the material, it's more than 20 years now since we started to work with the gel. We've done a lot of preclinical testing, biocompatibility testing, and to understand the material interactions with the tissues, it's very important to have a pathological examination of histologies. And the first work we've done in intra-articular injections were some rabbits around 2005-2006, where the healthy rabbits were injected with a hydrogel. Initially, we're looking at that as a pure lubrication, but after 12 months study, we could see that the material becomes part of synovial membrane. In a minute, I will talk about that a little more detail. And the rabbit experiments encouraged the veterinarian to try that in a cat, and the cats who were overweight and limping suddenly could run and jump. It was a great experience. Ended up with veterinarians starting to use that in equine species. And here the first horse injected actually was a life-saving treatment. The horse was on the way on a slaughterhouse, and after Arthrosamid vet injection, it actually came number 4 in the race 2 months after injection. We've done also some experimental work in the goats, looking at an experimental model of inducing osteoarthritis, how it works. And also then the veterinarians have also some humans working with horses who could see the good results in horses and wanted to have the same for their needs, and some compassionate use started around 2010. We've done the gel here is injectable hydrogel, which consists mainly of water. So it's a polymer of 2.5% dry matter, which bounds or swells in the water. It's homogeneous, there are no particles. It's biocompatible, as many of the studies done, and becomes integrated with vessel-bearing network in tissues, as soft tissues and intra-articular tissues, whereas the soft tissue is there. And exchanges water with surroundings, so it's not closed, a dead area. It gets exchanged with the surroundings with antibiotics or other substances and can then come into the gel. And the rheologic properties resemble actually the properties of normal synovial fluid. We have, as I mentioned, 20 years history with excellent results for different indications and a good safety profile. This is just the overview of the tests done. So there are biocompatibility testing according to standards, some specific bench testing, so we understand our hydrogel pretty well. What happens in the tissues is, then on the left-hand side, you can see that there are the schematic drawing of the gel being injected in the tissues, and those blue dots should example the macrophages. So attack a foreign body. The foreign body has been attacked, but as macrophages cannot digest the hydrogel, it became exchanged to fibroblasts and become integrated part of the tissues with no inflammatory cells. Here you see the electron microscopy picture of the cryofractured hydrogel, and this is a horse coffin joint 2 years after injection. The blue is a hydrogel, and the pink is a connective tissue, and you don't see really inflammatory cells here. Also an experimental caprine model. This is a gel sticking here, adhering to the synovial membrane in a joint. So in the tissues with synovial tissue after injection, the gel injected in the cavity becomes immediately interspersed with synovial tissues, synovial cells who segregate and multiply and start entering the gel. And here on the right side is the control with it in saline. After 3 months, this hydrogel now becomes part of the synovial membrane with new intima layer on the outside of the gel. So thickening the membrane of the synovial membrane. But compared to thickening of synovium due to inflammation, where you see inflammatory cells, including lymphocytes, monocytes, plasma cells, the gel's thickening of the membrane is benign. There are no inflammatory cells and very, very few macrophages or giant cells. So those effects in joints have been studied in different animals, like rabbits, horses, goats, and humans, and those data are published, showing that there's a response which does not contain any significant inflammatory response, is not ongoing granulose response, and that deposits of hydrogel become integrated into the tissues. In the horse joints, we've done a lot of clinical studies showing that actually they're good result with thousands of animals treated and no complications emerged. And equine studies demonstrate a long-lasting effect in a single injection, showing that at 24 months, 80% of the horses are lame-free. Like seen here in this graph, so the blue would be the lame-free, and interestingly also that initial effect is getting better with time, starting with 3 months around 60%, and the 24 months result actually is about 80%. And also interestingly is that joint effusion scoring is decreasing at 24 months. There are no effusion literally. And the gel also has effects in humans, which was mentioned before, compassionate use in humans since 2010, with several hundred knees injected, and there are some clinical studies demonstrating those good results. The analysis of compassionate data with 100 patients, open label study with 50 patients, and so on. And Professor Bredal will discuss the clinical data in more detail. So in summary, it's been actually the hydrogel has been in human use for various indications since 2000 and has a good safety profile. Bench and biocompatibility studies, as well as literature, show that there is excellent biocompatibility. Our rheological properties of the hydrogel is similar to normal synovial tissue, and it becomes integrated in synovium with enmeshed with fibrous-like synovial cells, originating from synovial membrane. And we have demonstrated in clinical studies, both in humans and animals, it significantly reduces the pain, long-lasting. Thank you. And then I think Henning to continue the clinical.